Our first Commander-in-Chief, George Washington, once said, "The willingness with which our young people are likely to serve in any war, no matter how justified, shall be directly proportional to how they perceive the veterans of earlier wars were treated and appreciated by their country." Taking care of those who have sacrificed for our nation is, I believe, our sacred duty. It's a national promise that goes back to Presidents Washington and Lincoln. President Obama actually acknowledged this during his campaign when, on the floor of the Senate on April 10, 2007, he said, "These are soldiers who fought in World War II, Korea, Vietnam, and Iraq. They made a commitment to their country when they chose to serve, and we must now keep our commitment to them." I could not agree more with those words, but in the meantime, as we all know, he was elected. Yesterday, we learned that President Obama plans to move ahead, despite what he said on the floor of the Senate, and start to charge veterans private insurance for the treatment of combat-related injuries. Let no one be mistaken that the President's plan breaches the moral responsibility the Commander-in-Chief owes to veterans wounded on the field of battle. It is a breach of our national promise, and we should not let this stand. The proposal is outrageous and beyond belief. The men and women he proposes to charge are those injured on the field of combat. These are people who sacrifice not only their sweat and tears, but their flesh and blood so that the American dream can be protected. Mr. Speaker, what must the average American think? Just recently, the criminals at AIG received hundreds of millions of dollars in bonuses paid by the taxpayers. Is the President now seriously considering balancing a $1.7 trillion deficit on the backs of veterans? To do so would be a great insult to anyone who ever wore the uniform of this great country. With that, I yield back the balance of my time.
The gentlewoman yields back the balance of her